Now moving on guys, after discussing the anastomosis at the elbow, I hope you are following, we are going in a sequence. Now moving on after this, let me tell you one of the most important point when it comes to the ulnar artery and the interosseous artery guys. Fine. So now here imagine this one here as your common interosseous artery here, and the common interosseous artery will be actually dividing into the posterior interosseous artery and the anterior one guys. So you imagine this one is the anterior interosseous artery here. So imagine this one here to be the anterior interosseous artery, and then this one here, you just imagine this one to be the posterior interosseous artery guys. So I am using the same short form again. This is the common interosseous artery, and this one here will be the anterior interosseous artery, and this one here will be the posterior interosseous artery here. You all know very well there will be a membrane in the middle, and that membrane will be nothing but your interosseous membrane between the two bones. Now what is going to happen here is, in the distal end, I mean to say not the proximal part sir, in the distal part. For example, you just imagine this one is your interosseous membrane here. Now if this one is the interosseous membrane over here guys, now what is happening is in the lower end, or we can say the distal end, the anterior interosseous artery will be there and there will be posterior interosseous artery. In the lower end, what is going to happen, the anterior interosseous artery is actually going to pierce this membrane, and then it is going to become, or it is going to go behind the interosseous membrane guys. Hope you are getting it. So in the lower end, what is going to happen, the anterior interosseous artery is going to pierce through the membrane and go behind, and then it is going to travel behind. So because of this reason, what is happening here exactly is, in the lower part, the anterior interosseous artery is the one which is traveling along with a nerve. And what is the nerve that is going to be present behind? Of course, it will be the posterior interosseous nerve. Are you understanding? Hope I am not confusing you here. I will repeat this once more for you people guys. There will be anterior interosseous artery and then there will be posterior interosseous artery. But in the lower end, what is going to happen? The anterior interosseous artery is going to pierce the membrane and go behind. It's going behind. So what is the artery traveling here? What is the artery moving here? That is your anterior interosseous artery. But what is the nerve present here? That is your posterior interosseous nerve, which is a branch of radial nerve. And those two are the one which are going to pass through the extensor retinaculum. And we have discussed that in detail. Extensor retinaculum is actually having totally 6 compartments, and out of these 6 compartments, compartment number 4, in the 4th compartment passes anterior interosseous artery, but along with the posterior interosseous nerve. And that is what is confusing a lot of students, like how come behind in the extensor compartment, how come it can be anterior interosseous artery. So I hope I have cleared that one guys. So better you write down here once more, this will be the anterior interosseous artery, whereas this is the posterior interosseous nerve, pin, and these two together, they are going through the 4th compartment, passes through the 4th compartment of extensor retinaculum. Okay, so together those two are actually going to pass through the 4th compartment of extensor retinaculum. That is something really important to learn about the interosseous artery guys. Perfectly done. Now after learning about this concept over here, then let us move ahead into the palm. Now in the palm, what is going to happen, on the medial side we will be having ulnar artery, and that is the one which is going to form your superficial palmar arch. And on the lateral side we will be having radial artery, and radial artery is the one which is going behind in the anatomical snuff box, then taking a turn and then entering here via, or we can say between the two heads of dorsal interossei. Dorsal interossei will be bipinnate muscle. So between the dorsal interossei, what is going to happen? It will enter inside, and it is the one which is going to form your deep palmar arch. So superficial palmar arch will be formed by ulnar artery, whereas a deep palmar arch will be actually formed by the radial artery. So let us discuss about the palmar arches now, sir. So let us discuss about the palmar arches. There will be 2 of them. One is the superficial palmar arch, and another one will be the deep palmar arch guys. Now in this diagram, you are actually able to see the palmar aspect. So imagine this diagram as palmar aspect. It's not the dorsal aspect guys, it is actually the palmar aspect. Now in the palmar aspect, first of all, one important thing here you will be able to find one retinaculum guys, and this retinaculum here will be the flexor retinaculum. So you just imagine this one here to be the flexor retinaculum, fine. Now on the medial side, what is the artery guys? That is your ulnar artery. An ulnar artery will come here on the medial side. It is going to pass superficial to the flexor retinaculum, and then it will continue here to form the superficial palmar arch. So this one here will be the ulnar artery, and ulnar artery is continuing there to form the superficial palmar arch. Don't worry, I'll just make you write down separately in the notes also. It is the one which is going to continue and form the superficial palmar arch. Whereas on the lateral side, what is going to happen here, sir? On the lateral side here, this one will be your radial artery here, or better we'll do one thing here. Let's take another color. On the lateral side, we'll be actually having the radial artery, and radial artery is actually going behind into the anatomical snuff box, and then it is going to pierce through that dorsal interossei, and then it is going to form the deep palmar arch. So radial artery is the one which is actually going to form your deep palmar arch. Perfect. So basically you'll be having like two palmar arches, one is superficial palmar arch, another one is a deep palmar arch, and a radial artery is the one which is going to form deep, and superficial palmar arch is going to form by ulnar artery. And I want you all to remember two important landmarks here. Number one, this one here, radial artery is going in the anatomical snuff box. And number two here, yes, it is going via or through the dorsal interossei. So it's actually going between the two dorsal interossei there, okay. So first dorsal interossei, it's actually bipinnate, and bipinnate dorsal interossei, between that what is going to happen, the radial artery will be passing. And I have also taught you, when I taught you about the muscles of hand, after passing through the dorsal interossei, the radial artery is actually going to pass between the two heads of adductor pollicis muscle, and then it is going to form the deep palmar arch, guys. Comfortably done. Now don't get confused here how it is completed. Formation is done, how it is completed. So remember here, the superficial palmar arch, first let us deal with the superficial palmar arch. That is the one which will be completed by a branch from the radial artery. Superficial palmar arch will be completed by the branch of the radial artery, guys. So radial artery will give a branch here, the superficial branch, and that is the one which is going to complete the superficial palmar arch. Whereas a deep palmar arch will be completed by a branch from the ulnar artery, the deep branch of the ulnar artery, guys. Hope I'm not at all confusing you here. So formation is important there, guys. After the formation, it is completed obviously by the artery on the other side, but there is a branch of that one. Now once you are done with this one, let's see what are the branches given in turn by those arches. Arches are actually going to give the branches. Let's see what are the branches given by them. Now radial artery will first of all give a branch here to the thumb, and this branch or this artery which is given to the thumb there, it is actually known as the princeps pollicis artery. It is the principal artery to the thumb, princeps pollicis artery. And not only that, the radial artery will also give like one more branch to the radial side of the index finger, the radial side of the index finger. So don't get confused here. The radial artery will be actually giving a branch to your thumb here, that is your princeps pollicis artery, and it is giving a branch to the index finger, but that is towards the lateral side, radial side. So that is why the name of that artery will be the radialis indicis artery. So let us write down the name here. So this artery over here will be the princeps pollicis artery, and this one here will be the radialis indicis artery. Radialis indicis artery. That is from the radial artery, guys. Now what about the ulnar artery on the other side? The ulnar artery, or that superficial palmar arch. That superficial palmar arch is the one which is actually giving rise to the common digital artery. Then there will be one more common digital artery here, and then there will be one more common digital artery here. And this common digital artery are in turn dividing into the proper digital artery here, guys, and the proper digital artery here, proper digital artery here, and the proper digital artery here, and exactly the same thing on the other side also. Fine here, proper digital artery. And lastly, what is going to happen here, the ulnar artery will also give a branch over here to the little finger, guys. Understanding? So I'll just write down here C here for the common digital artery, this one here, okay, and just writing down P here for this artery, guys, and that will be the proper digital artery. So what is that C standing for? C stands for the common digital, because it is to the digital artery, and then P stands for the proper digital artery. Perfect. So that is about the common digital and the proper digital artery, guys. So hope it is clear here. Okay. So it's very simple here, guys. First of all, you learn about the radial artery here. Radial artery is giving a branch to the thumb there, and thumb, it is actually the principal branch to the thumb, princeps pollicis artery. And radial artery is the one which is giving a branch to your index finger over here towards the radial side. That is why radialis indicis artery. And then remaining everything is taken care by the superficial palmar arch. Superficial palmar arch will give common interosseous, common digital, and that is further dividing into the proper digital artery, guys. So that is how you have to learn about the palmar arches here. So one last and final thing, which most of the time they'll be asking in the exam, and in the exam students are trying, getting confused over there. Palmar arches, you will be actually having two of them. One is the superficial palmar arch. One is superficial palmar arch. Another one will be the deep palmar arch. And you have to remember only one thing here, guys. Which arch will be formed by which one? Remember, superficial palmar arch is formed by ulnar artery. And deep palmar arch, it is the one which is formed by radial artery. It is formed by the radial artery. Fine. Now during exam, what will happen? You will have like all the subjects in your mind, and students are getting confused over there. I want all the students to just concentrate on one simple thing. The deep palmar arch, okay, starts with D, and look at the name of those two arteries, that is ulnar artery and radial artery. Look at the spelling there. Whichever spelling has got D, that is the one which is going to form the deep palmar arch. Is it okay? So therefore, the deep palmar arch will be formed by radial artery, and obviously the another one, that is superficial, will be formed by the ulnar artery, guys. Is it okay? That is one simple mnemonic that I am giving you at the end of this one, so that you can remember it perfectly, guys. So that's all about the palmar arches, and that was the last and final thing in the blood supply to the upper limb. So if you are seeing all the videos in continuation, we are done with the axillary artery, the scapular anastomosis, brachial artery, and the branches of that, and then anastomosis at the elbow. Then we have discussed about the interosseous artery, and then finally about the palmar arches. So everything has been done in sequence completely. Thank you.